how things have changed in the last 10 years. So what Peggy went through, how is it different than what you're doing now? How is it similar to what's happening now?
That's a great question, because honestly, this symposium actually is called the International Spinal Deformity Symposium. That's a mouthful, so we abbreviated it ISDS. But it's really focused on scoliosis and other spinal deformities in adults. That's really what the theme of the meeting is. And so, what has changed in 10 years? First of all, what's not changed? Number one is that the indications for surgery are pretty similar.
Interesting.
Honestly, 10 years ago than they are now. We talked about progressive spinal deformity in the patients who are symptomatic from that with a deteriorating quality of life. Those key components are still the main indication that patients have surgery for scoliosis or other deformities in the adult brain. And the other thing that hasn't changed, we're still doing spinal fusion. So we're correcting the deformity into a better alignment, because we know that allows patients to have a better quality of life and have better outcomes when not only straighten the curves, but we give them a good shape from the side and do other things technically in surgery that give a good long-term result. But we're still doing a fusion. We're still basically, after we correct the spine into a better alignment, we're immobilizing all those vertebrae into one kind of stiff segment of spinal regions that won't ever change. The good thing is it won't ever change. Your scoliosis won't ever come back. But unfortunately, you lose kind of mobility to those segments. That isn't ideal. But we have not, to this day, been able to come up with a solution that allows us to correct deformity and maintain motion over multiple segments in the adult with good long-term results. So everyone still in the audience is still, all the surgeons we're still doing fusions. But we're getting better at it. Our surgical success rate for fusion is getting better. Probably the biggest change over the last 10 years is our complication rates are much less, both during surgery and after surgery. And that really is not a reflection only of the surgeons, but anesthesia is better, nursing care is better. And we created every center in the country that does this have created teams of carers that kind of focus on all aspects of the surgery. Even the preparation is better. I now have a program that everyone gets, and you didn't have this 10 years ago, we didn't have this 10 years ago. You get an initial evaluation by a physical therapist when you first see me, and then you're giving a rehab program to get in shape to optimize your commits before everyone gets prehab specific for you. Actually, I have a grateful patient that actually donated a grant support to this, because that's one of the things you didn't have that for her. And she said that I wish I would have been in better shape going into surgery. I would have had an easier recovery. So she actually, her and her husband funded a program to allow us to evaluate every single new patient of mine to get a.
That's such an important point, Dr. Lenke, because oftentimes patients are in pain or they're uncomfortable, and so they're not moving, and so that prehab part is so hard to do. So getting a specific program for you to optimize anything you can.
Exactly.
Before the surgery,
It's logical. If you're in better shape before surgery, you're going to have an easier time to recover afterwards, all things being equal, right? So that's critical. So that's changed dramatically. The other, probably technically, the thing that's changed the most is that now we have customized implants. So up until 4 or 5 years ago, basically to kind of put the shape of the spine together, every surgeon kind of took a straight rod and kind of bent what they wanted the shape to be and kind of put it in the patient. And probably the more senior you are, the better you were at doing that on average. But I'd been doing deformity surgery for 29, almost 30 years before I started using them, these custom, what's called patient-specific rods, which are kind of through computer engineering and machine learning. We kind of work with engineers individually on a case-by-case basis to create rods that are specific for the patient we're being treated. So they actually come to the OR kind of bent to the shape we want the spine to be in.
Wow.
So even in my hands, after 30 years of doing this surgery, I've reviewed now my results before using these custom rods and after, and my rates of complications have dramatically decreased. So point being, that's why I tell even the junior surgeons, if they can make me a better surgeon after 30 years, my goodness, it's probably going to help you as well. See, that's one of the biggest changes, and that's been made, at least in my practice and many other deformity surgeons' practice the last.
It's interesting to think about personalized healthcare coming to spine,
right?
And how does it manifest in the spine, right?
In a very practical way. Yeah. It makes sense. Obviously, so I'm deciding on your shape of your spine, not during surgery, but, several weeks before the surgery, I'm looking at a computer screen and I'm shaping your spine to what I want it to look like. And then basically we have algorithms that kind of tell me whether that's going to be green, yellow, red. Is that a good shape?
Wow.
Average shape, or not very good shape. And so it's very,
So
very
planning.
is being critical. And then again, planning and then execution is easier, because then if I hit my plan and put these rods in the patient and the shape is maintained, then we know we've kind of executed on our plan.
Yeah.
So we can confirm that. And up until several years ago, we had no way of confirming that.
Yeah.
So you would think we'd do that, but we weren't. No one was doing it. That's still not being used in the vast majority of surgeries in the world. So, but slowly over time, this technology is going to
Adopt.
develop, because it just, again, it makes sense, and it's been proven that the results are much better.